How often do you see patients with hypothyroidism who are well managed but still complain of persistent symptoms? You know the routine. Prescribe thyroid medication, regularly check the TSH and T4 levels, right? Even with well-adjusted values, some patients continue to report complaints that can severely affect their quality of life. Think of complaints like extreme fatigue, brain fog, so due to concentration problems and poor memory, weight gain, difficulty, or even inability to lose weight. But also hormonal complaints, so think of infertility, difficulty getting pregnant, heavy or very irregular menstruations, constipation, but also depressive feelings, pain in the muscles and joints, and especially always feeling cold, and hair loss, and so on. Well, what do you do if these symptoms persist? Despite the lab values actually being within the reference ranges, often these patients hear that it is part of the slow thyroid and that they must learn to accept it. Or they are told that these complaints are not caused by the thyroid because it is well regulated with medication. But what if this is not the whole story? In 90% of hypothyroidism cases, Hashimoto's disease is the cause. And precisely this, is a crucial detail. Because this is not a regular thyroid condition. It involves an autoimmune disease that attacks the thyroid tissue. And this information is still widely known. However, what is often overlooked is that this piece leads to inflammations. That is not only inflammation in the thyroid itself, but inflammations throughout the entire body. My name is Marloes Mulder, and as a dietitian specialized in autoimmune diseases, particularly Hashimoto's disease, I would like to introduce you to a completely different approach that goes beyond just medication. Under the guidance of Professor and Dr. Morissette, a prominent expert from America, I learned how to address the residual symptoms in patients with Hashimoto's. This approach is completely evidence-based. The essence of this approach is that the treatment of Hashimoto's disease is done from an autoimmune perspective. And that means the goal of the treatment is to suppress the autoimmune response and thus also reduce the inflammation. And I do that by identifying and also removing the underlying triggers responsible for the flare-ups of the disease. These triggers are often found in nutrition, lifestyle, and sometimes there are also medical triggers. Ultimately, it's a search and customization, resulting in a different set of triggers for every patient with Hashimoto. How would you react if I told you that a lot of these rest complaints could be significantly reduced? And that is not only by supporting the thyroid itself with medication, but also by addressing the accompanying autoimmune reaction and inflammation. And with that, we can drastically improve your patient's quality of life. What is the first step, you may wonder? Well, besides checking the TSH and T4, it's also essential to test the antibodies, the anti-TPO, and the anti-TG. Because this can actually confirm whether it's Hashimoto's disease. And this way, you can implement a targeted treatment that goes far beyond just providing thyroid medication. But just to be clear, the approach I use is therefore, in addition to providing thyroid medication. Thyroid medication is always the first important step. If this information is new to you and you have questions about it or want to know more about how I apply this approach in my practice, feel free to contact me. Together, we can ensure that your patients not only survive, but also start living again.